All right, let's focus now on the ongoing conversation around the health sector in the country. The National Assembly Health Committee has initiated a probe into what it terms fraudulent activities at the National Hospital Insurance Fund, NHIF, where the fund officials are accused of conspiring with private facilities to receive undue payments, denying funds to deserving facilities, especially public ones. Speaking during a committee sitting where the PS Medical Services Harry Kimtai, together with two NHIF bosses, appeared before the Health Committee Chair Robert Bukose, stated that the inquiry also expected to ascertain the reason why many patients with NHIF cards were being turned away from facilities and who should be held responsible. Early last week, Health CS Susan Nakhumicha suspended NHIF officials linked to the alleged payment of monies to private facilities, yet some of the patients had not received the listed treatments. Here's Chimtai Goin with that report.
With widespread allegations of alleged collusion between some NHIF officials and private medical facilities to receive payments, despite not rendering services rife, and with media reports having unveiled a scheme where patients were charged for treatments they had not received, while others were turned away despite having NHIF cards, the Health Committee has stepped in to unravel the mystery surrounding the goings-on at the NHIF.
We intend to open an inquiry, because Kenyans cannot be fleeced of their contributions. This committee will not watch as individuals within the NHIF mismanage the public money.
How does NHIF identify such frauds? Do they have a risk? The audit department? All these things here, and one member also asked, what is the organization of this NHIF? Will then provide a more detail so that you're able to interrogate the NHIF and grind down to the finer details of where the loopholes are NHIF can be identified through this committee, and whether NHIF have taken action previously or not.
The committee noting that the issues bedeviling the fund were grave and threatened the bid to enhance universal health coverage for all Kenyans, members saying heads must roll.
The gist of our sitting today is for the voluntary contributor to know why they have an NHIF card, they have gone to PGH near outpatient, admitted, then they have to go and buy normal saline for injections at a private hospital, at a private facility, yet they paid NHIF in advance.
When I see you on the chair of NHIF, you have to be serious with your job. This is Kenya's life. This is Kenya's life. This is the only institution which can bring UIC to life. And without NHIF, there is no UIC. And we cannot allow you guys to just bring down an organization because of your creed.
According to documents in the committee's possession, private facilities were given preferential treatment in the remittance of monies accrued from contributions, while public facilities were choking under the weight of debt and in some instances unable to render the required services.
Looking at your statement, you have a surplus. In one hand, you are unable to pay. In one hand, you are investing in shares. In another hand, you are giving hospitals loans, like I can still give even MTLH a loan. We have so many investment portfolios for shares in banks and all over. What is priority? What is the comma date?
How do you end up paying to the facilities that you have not even ascertained that they are providing services? Because I know before you pay a claim, there always a kind of review that you do.
Questions were raised over the leadership gap in the fund, as many senior positions were yet to be filled. The 15-member health committee vowing to get to the bottom of the matter and bring to book those found to have toyed around with the health and welfare of unsuspecting Kenyans for their own gain. As it attempts to seek a solution to that which ails the National Hospital Insurance Fund, the Committee on Health is set to institute an inquiry to ascertain the alleged incidents of fraud. One of the issues they will also be looking at is whether the delayed confirmation of many of its acting directors has contributed to the reported incidents. Chemutai Goin, Citizen TV at Parliament Buildings.